Morning. Today, Wednesday the 18th of November, marks the start of World Antimicrobial Awareness Week, which is a World Health Organization global campaign to raise awareness with regard to the responsible use of antimicrobials. I'm delighted to be joined by Connell, community pharmacist and well-known advocate for preventative disease programs such as the HPV vaccination program and the hepatitis C treatment and prevention program. Kate, good morning, and you're very welcome to Virtual Vets Handle with Care campaign.
Thank you very much for having me, Mary.
So Kate, I'm going to kick off by asking you, really, what do you see the role of the community pharmacist being in terms of raising awareness and responsible use of antimicrobials, please?
The key piece for us is that engagement post-dispensing, where we explain to patients the correct intervals, the duration of the treatment, and things to look out for. So what we do find is that where that conversation happens and where the patient is listening, people are more likely to adhere to a regime. What we also find is, with adults in particular, where symptoms clear early, so in the case of urinary tract infections, and that there is perhaps less compliance as people perhaps go into day 4 and 5 of treatment. And so we have to target those patients in particular to explain the importance of completion of the course. And what we do find is that the body of evidence points to where there is that critical conversation, that people are more likely to be adherent and continue the course as prescribed by their doctor.
Very good. So that communication piece there, that is really key to the responsible use of antimicrobials. I know from a veterinary perspective, there has been plenty of publications and plenty of research done with regard to compliance and the lack of completion in some areas of antimicrobial courses of antimicrobials, when the animal is seen to be look better and behave better, and then the antibiotics course is not always necessarily finished out in a responsible fashion. For the pharmacy profession as a whole, and I understand, there's different types of pharmacists in terms of hospital pharmacists and pharmacists in industry. How do you as a profession, how do you see antimicrobial resistance as an issue?
Well, I mean, as you mentioned, pharmacists work across drug development. They work in hospitals in terms of formulary development, and that feeds down then to us in the community who work with the patients and with the GPs. And we do see it as very important, because as drugs are developed, new molecules are found and modern therapeutics become available. It is almost accepted that you need adequate antibiotic cover to go hand in hand with these therapies. What this week, I suppose, is highlighting is that you can't assume that antibiotics will always be there to go hand in hand with modern medical developments. So we see it as very important, because we understand the risks. I mean, if the World Health Organization is saying that antimicrobial resistance is one of the top 10 threats against humanity, well, obviously, we pharmacists as medical professionals get it and know that we have to work hard in order to advance medicine but protect that which we have already, which is antibiotic cover.
Okay, so really what we're talking about here is a collective effort across communities, across professions, to use antimicrobials responsibly, because they are a precious yet exhaustive resource. And by working together and by using antimicrobials responsibly, as health for animals say, as much as necessary, as little as possible, by working together, we can tackle AMR and protect these molecules for future generations. Kate, thank you very much for joining us this morning. I hope you'll follow the campaign throughout the week. We've got lots of interesting contributors from across the healthcare and agri-food sector. So thank you very much for joining us, and take care.
You're welcome. Bye.
Thank you.